Hi everyone, week 3. Wow, can you believe this? It's like flying by. You'll have to excuse me. Had a rough week, rough, busy week. Just actually even tonight I had a meeting with my TAM, which was really great, and then I rushed off to um, a local area collaborative for my job that I do, and I'll explain that as I talk about network leadership because it goes perfectly with our topic. And I rushed home to actually go teach my Zumba class, and my daughter was broken down on the side of the road. So I had to rush out to get her and arrange for my husband to meet me there. But yeah, so, and now I'm rushed back home to finish this assignment, which probably should have been done a few days ago. Anyway, network leadership and power is two interesting things. I can first bring up that I was discussing this with my TAM in relation to my project. So, as many of you know, I'm actually trying to help women and couples, and it looks like it's leaning more towards couples to empower and encourage them and heal if they've been affected by pornography. And it's interesting because my Tam and I were discussing that, people would want big change, and I had some people actually encouraging me to try to change legislation or things like that, um, change laws. And although I do think those are important, what I was discussing with Dr. McKinney today was that sometimes if we stop a certain demand for something, so if we encourage and inspire, and we help people break the addiction, because I mean, it could have been like you could compare maybe certain addictions to like prohibition. Like we don't want to totally get um, and even cigarettes. I'm surprised actually, even the amount of money that have gone into cigarette campaigns, although they are good, there's still quite a few people that continue to smoke and make that choice. So we actually have to try to change individual minds and hearts. That's what change people's thought process. Then things might start to, bad habits may start to decrease based on demand, or bad things offered may decrease because the demand is not there anymore. So basically these companies know what feeds someone's addiction. They basically have psychologists study that side and make things effective to get people hooked onto things. So that, I believe that's how a lot of companies work. And so it would be difficult for me as a regular lay person, or whatever you want to call me, just an ordinary person, to take on a $1 billion industry. But if I can start change from the bottom up, which we can kind of discuss in network leadership and power, it could be an effective method for change. I also like that it talks about collaborating and working with people. A good example of this. So I actually work 45 minutes from my home. So the interesting thing is I work for a hospital that's 45 minutes away, and I originally started working there because my parents are elderly and they live near that hospital, so I check in on them, and it made it a little bit easier for me to already be up in that area, to be able to check on them, to be able to go to their appointments, which are up in that area. Yes, very little, a little difficult to have a drive 45 minutes, but an interesting position came up. They actually wanted me to have, it actually required a bachelor's, but I was like, I don't know, I'm gonna try out for it. The amazing thing was, a few years ago, the Office of Early Childhood had grants out for different programs, family advocacy centers, and what I work for is called Nurturing Families Network. We do home visits. So a lot of the local areas had it. So even though the hospital that I work at is 45 minutes from another hospital there's a hospital in the town that I live in, they're all still in the same county. So I guess the Office of Early Childhood had a lot of these grants, and there was similar positions, in the town that I live in, plus in the town where I work in. And they just took all the grants back. They're like, we're not renewing any grants. Everybody's gonna reapply for these grants. So my boss, who is the most amazing person, with the director of our program as well. So both were like, let's just try for anything. So they wrote up a proposal, which was granted to our department for myself and a father parent educator. And it actually sat pretty vacant for a while. I applied, and they just said that I was like the best mix, and they really wanted to use me because I live in the community where that it partnered with. So even though it was 45 minutes away, they thought it was an amazing mix. So I raised my family in this town. And so I do have some connections, but they've changed because my youngest is 17. So I'm not quite in with, the parent resource centers anymore. My kids aren't in, grade school or preschool. So I really had to start reaching out. I specifically work with the high school for parenting and pregnanting teens. So this has been a difficult transition. I've been in the position since October, and people are thinking, what is this girl from Day Kimball, Putnam, up in a different area, doing in our town? But they don't realize I actually live here. So I attended a meeting tonight, which is the Early Childhood Readiness Council, and it was really good. I was trying to say, like, I'm not here to step on toes. My kids were born in this hospital, even though I work there. And it was just interesting. I I feel like we shouldn't be, and even if it was, you know, this community versus that community, we should be working together to serve the families in both communities, because we are all in the same county, so it shouldn't be that. So my supervisor really sees that I've taken the initiative to really try to work with people, and I believe that's what network leadership and power is. It's the ability to be a leader, but to work closely in collaboration with people, and talk to them about partnership versus, this is not a competition. We're trying to serve the best needs. And the way that I see it is, there's more people that do the same job, and there's more families that we can serve. Uh, with the terms power over, power with, power within, power to, I just want to, for my project, I would like to do power with, because I'm trying to collaborate not only my church for this, I'm also have included my TM is a behavioral health specialist at the hospital, and we touched upon this today about that, healthcare, people's health is really important, but so we focus in health. The the doctor may say this person has diabetes, you need to change your diet, you need to do this, but if we're not looking at a whole well-being, a family member could be struggling with an addiction. They could have lost their job due to pornography use. So how are they to take care of their health, when they have, and we touched on so many issues. Some of the families I particularly work with have housing problems and transportation to get them places. So instead of a hospital or healthcare system looking at just the health of the patient, we need to collaborate, like the whole, all of it together, encompass it. So I'd say that would be power with. I don't, this is sometimes why, and people may be disagree with me, but sometimes that's why I worry about how much government will control. I believe in a more free, system. Like I mean, I definitely would want everybody to have access to good health care. But when we say universal health care, you think the government taking control, and then how good is our health care? Just because I see kind of the track record of, so much need in our schools and how the government handles it. And I think power with would not only include the people like holding the purse strings, but also would include the people that need the services. So a good collaboration would be, for instance, listening to the parents as well as the teachers as well as the government officials that control the money, like for in a school system. So it would include all those. For my particular use for pornography, so I would like to bring in, that's why I think I'm actually going to focus more on couples, because everything seems to be separated. A lot of help for the person addicted to pornography, which is higher statistically, is men, although women are growing in numbers for their addiction to pornography. But that's why how we view it different by the genders, how we can work on it together as a couple. Then I also want to take a behavioral health specialist, how church views it, and the couple struggling with it. So just all working together so nobody's having a power, but everybody has a say. That's especially why I wanted to bring my husband into my project, because I didn't want it to just be me going nah, 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 to him and saying, look at me. No, I've realized that pornography has affected me well before I had met him. So there's certain situations in my life. So as I do more research and I self reflect, I'm realizing that. So just power in general, that we distribute the power and become leaders, and we try to transfer the power and encourage others to take on those roles. And I don't think I always saw myself as a network leader, but I really believe that I've been gaining the tools and understanding what it takes to be a strong leader. It's not like I've got this idea in my mind and this is what needs to happen. I think a good leader takes the time, especially a network leader, is to see who's in their pool of resources and really taking the time to listen to them. So I'm realizing that even though my TAM is doing a huge service for me, which I was really nervous because I'm like, he's a really busy man and he's taking this time for me. He also is wanting to me to sit on a board and, with him as well. So now I've networked to another capacity. So he's able to help me. And then also I will be able to help him because I believe in his mission to kind of more combine mind, body, spirit, um, like more of a different model within the healthcare system. So where someone could go to one place and not only get their health, but their behavioral health specialist, and they can all be in one place. And there's other states that actually do this. So just, yes, I'm starting to see myself more as a network leader because I'm willing to sit at the table, find out how I can get into meetings, because that's exactly what happened tonight. I found out about the meeting at the early childhood council, and I called up and I said, "Hey, can I have a seat at this table?" And they were like, "Yes," and they were so nice, and it was really great. So just taking the time to do that and figure out what councils are happening, what committees, what meetings, and finding out if you play a role there. What services can you offer them? What can they offer you? And I was really glad because I actually found out about a diaper bank, which is something that I thought that I was going to have to invent in this town, and somebody's already doing it. So that's amazing. So I made that connection tonight too. So that is what's going on at work. But yeah, my project is going well, and I'll explain that in my other video. Hope everyone's doing well.